So what I thought I would do is I'll go through each set, and then if you have questions about those particular supplements, we can stop and you can ask questions, and hopefully we'll be able to get through all of them. So the first thing about supplements is that what you see on the internet is not necessarily what your child needs. Every kid is an individual, and not every kid needs every supplement. You want to check with your endocrinologist or a physician before starting any supplement at all. Now, physicians often won't know a lot about supplements, so you sometimes will need to come in armed with some information about them, but you definitely need to just check and make sure they're safe for your child before you start. The first are for infants, CoQ10 and carnitine. Both of these are in the wall of the mitochondria in the muscle. CoQ10 is one that we use often for infants who fall asleep while they're feeding. So they suck, sleep. And CoQ10 anecdotally can improve their sucking. Am I okay? Am I feeding back?
I'm just going to mute it.
So CoQ10 anecdotally can improve the sucking and swallowing in babies, and for some, it's pretty miraculous at being able to get them out of the NICU without a tube for feeding, but certainly not for everyone. It appears that CoQ10 and carnitine are effective in about 20% of infants with Prader-Willi syndrome in terms of the effects that they may have. Carnitine is also in the muscle, in the mitochondria, and improves alertness, strength, and tone in individuals with Prader-Willi syndrome. So I encourage parents to ask their physicians about these two supplements when the child is either an infant, especially for CoQ10, or if they develop worsening daytime fatigue. Both of these can be sort of energizing and improve the energy level and alertness of a child with fatigue. Before we started, I was talking to one of the moms, and carnitine is actually a natural treatment for what's called narcolepsy, which is excessive daytime sleepiness, where you just fall asleep at the drop of a hat. And carnitine can work to treat narcolepsy if you don't want to use a medication for your child who has daytime sleepiness, because it is a supplement. CoQ10, for premature babies, the dose is 30 milligrams per day. Full-term babies, 50 milligrams per day. And then over age 2 and adults, the dose is 100 milligrams per day. This is always given in the morning because it's energizing, and so you don't want the person to stay awake all night long. Carnitine, same thing. You give it in the morning. The dose is based per kilogram. We typically always use prescription grade carnitine, which I've been told is not available in the UK. The reason is because over-the-counter supplements are not super well regulated, at least in the United States, and so you're not sure what you're actually getting if you get an over-the-counter preparation. So we try to use only prescription grade carnitine in the US, especially for the babies, so we know exactly what we're getting. And the dose is on there. It's 50 milligrams per kilogram per day. Some people give it as a single dose in the morning. Some parents divide it 2 to 3 times a day. Again, it's activating, so it can be very not good for sleep. And so you don't want to give it too late in the day. Those are the infant supplements. Do you want to stop here? Does anyone have any questions about those two supplements? And then I can go on to the supplements for older individuals. I hear nothing, so you're going to have to like raise hands if you.
What we'll do, Jennifer, we'll put you back up, turn the mute off. We might put it back on when you're giving the answers, then you don't get the feedback.
No, sorry, I was just going to say we've asked if we can do the presentation first and we take questions after, just because of the filming.
Is that okay?
Perfect. All right, turn me back. Yep, that's perfect.
Can you hold your question till the end? Okay, thank you.
Is that all right, my darling?
Okay, so B vitamins I get asked about a lot. B vitamins typically are fine in infants and often in children, but can become abnormal after children start to go through what we call nutritional phase 2A, where the metabolism changes. Two of the B vitamins that are super important are vitamin B6 and B12, because both of these are directly involved in the synthesis of neurotransmitters. B12 frequently will improve the functioning of things in the frontal lobe as well as language function. So very important to know if these vitamins are sufficient or not. Some people see benefit from doing what's called sublingual B12, so letting it absorb through the mucous membranes, and some have to do injections. And the reason for this, we believe, is that I don't know that the gut, once metabolism changes in phase 2A, I don't know that the gut necessarily can absorb the B12 from the food that they're eating as well as it used to. And so what we often will see is some signs of B12 deficiency on the blood count. And so that's one of the things we look at when we're looking at the B vitamins, is the size of the red blood cells, because B vitamins are involved in the synthesis of red blood cells as well. And so I tell people the B vitamin levels in the blood are not very accurate. And so looking at the red blood cells themselves to determine B status is important. Vitamin D is also important. It's thought to be involved in the prevention of neurodegenerative or neuroimmune diseases like multiple sclerosis, and even Parkinson's. And so vitamin D is a very important vitamin for the brain. It is a fat-soluble vitamin, so can be overdosed, especially in Prader-Willi where there's more body fat present. So this is one where you definitely want to have the levels checked before you start this one and see if supplementing is necessary. With the B vitamins, you pee out what you don't need. So because they're water soluble vitamins. So those you can try, and it's not going to hurt you if you don't need them, because you'll just pee out the extra. You'll have expensive urine. But vitamin D can be overdosed and cause kidney stones, and so you definitely want to be sure not to overdose this one. You want to have the levels checked. Patsy and I were having a discussion the other day about vitamin D and calcium, and I was telling her that we typically, at least in the US, do not see low calcium levels associated with low vitamin D. We very often see low vitamin D levels in kids with Prader-Willi because people often limit dairy intake to try to limit calories and sugar. So they'll limit milk intake, cheese, yogurts, things like that. And so kids just aren't getting enough vitamin D in their diet. But we typically do not see low calcium levels. Both calcium and vitamin D are much better absorbed if they're gotten directly from food rather than from a supplement. So it's recommended that over age 1, that individuals have 16 ounces of a milk product per day that's supplemented with calcium and vitamin D, like almond milk or cow's milk or whatever, plus also 2 servings of something else containing vitamin D and calcium, like cheese or yogurt or something like that. And so the recommended is that growing children get about 1,500 IUs per day of vitamin D, and adults about 2,000 IUs per day. Magnesium goes along with calcium and vitamin D, so I always include it in this supplement talk because magnesium is a supplement that I feel can be helpful for a lot of the issues that can happen in Prader-Willi syndrome. So with low magnesium levels, you can get some anxiety, you can get some constipation, you can get bad bones, because magnesium is important for calcium and vitamin D to be taken up correctly from the gut into the bones. And there are 3 different forms of magnesium that people will often use. One is magnesium chelate. This is one that's found in foods naturally. Again, we don't know once phase 2A happens and the gut metabolism changes, whether or not people actually absorb the magnesium from the food correctly or not. But it is a very highly absorbable form of magnesium and is found naturally. Mag citrate is one that is really great for constipation. It improves digestion and prevents constipation. It's quite potent, actually, at preventing constipation. And then the last one is one that I'm seeing more and more often, which is magnesium chloride oil. And this is something that's applied to the skin. And a lot of parents anecdotally have found that doing the magnesium chloride oil on the skin 1 to 2 times per day can help with absorption of magnesium and decreased anxiety. And this may be because, as I said, it may be that with the change in the gut motility that happens with phase 2A, when everything sort of slows down, that you're able to actually absorb the magnesium from transdermally from the skin better than you can from the foods that you eat. This has not been studied, though. This is just anecdotal information. Iron is another one that can be overdosed, but is also often deficient in individuals with Prader-Willi syndrome. It's a really necessary vitamin to allow normal energy levels. Kids with attention deficit disorders, people with sleep disorders often have iron deficiency, and iron deficiency can be associated with fatigue and depression and lack of caring. Low ferritin, which is the storage form of iron, can cause very restless sleep. We call it restless leg syndrome. And so if kids are waking up a lot at night, one thing we usually recommend is checking a ferritin level as you're waiting for a sleep study, of course. But iron, again, can be overdosed, so you definitely need to check the levels before supplementing because you don't want too much iron because it can cause big problems in the body. N-acetylcysteine is another supplement that people often use. It is used primarily for the skin picking and nail biting behaviors in Prader-Willi syndrome. It modulates a system called the glutamate system, which influences the reward reinforcement pathway. And so it has been found to be effective on psychiatric disorders associated with impulsive and compulsive symptoms, so nail biting, gambling. It actually was first published for use in something called trichotillomania, where people pull their hair out, and is the only thing that has actually been effective in treatment of that condition. If individuals are on multiple psychiatric medications, like older individuals especially, you need to be very careful with N-acetylcysteine, as there can be some interaction with specifically the atypical antipsychotic medications. When Patsy and I were talking, one thing I mentioned that she asked me to mention here is that N-acetylcysteine is very rapidly oxidized when it's exposed to air. So if you buy a bottle of N-acetylcysteine in the health food store and you open it up, by about the 3rd time, you're giving nothing, because every time you expose it to the air and it gets oxidized, it becomes ineffective. So that's why people will often report that N-acetylcysteine worked great for them for a week and then it stopped working, and that's because it's become ineffective because it's exposed to the air. So the brand that we typically recommend is something called Pharmanac, and the reason is because it's individually packaged. Each individual pill is individually packaged, so it doesn't get exposed to air until it's open to be used. One thing that I've found to be effective if you cannot get Pharmanac, which I have heard you cannot in the UK, is that if your child does need N-acetylcysteine, that you ask if a pharmacy can bubble pack the NAC for you. So sometimes they can put it in an airtight, like sealed thing where you can just pop it out when you need it. And we found that also can be effective at keeping it from being oxidized. The N-acetylcysteine, the other thing you need to know about it is that if you give it within 30 minutes of anything containing calcium, it doesn't work. And so people very often will give it with the milk in the morning, or they'll stick it in a bite of yogurt or whatever, and it actually makes it completely ineffective if it's given with calcium. So I always have to remind people that this doesn't just mean cow's milk. It means any of the milks that are supplemented with calcium, any of the nut milks, soy milk, that kind of stuff, yogurt, cheese, or dark leafy green veggies. Typically, I recommend that people give N-acetylcysteine at bedtime, just because most people don't drink milk at bedtime, and so that it can be utilized by the body correctly. Here we have tried naltrexone, which is a medicine that's actually used for opioid overdose. for the skin picking in people who didn't respond well to N-acetylcysteine and were still having the picking behaviors. In a small open label study we just did, it looked like it was about 70% effective in stopping the skin picking, nail biting behaviors. So not completely effective, but it did work in many. Naltrexone has the added bonus of decreasing appetite. It's being used in one of the weight loss medicines that's marketed here in the United States, and so it can decrease appetite as well. So we have a couple kids that were having bad trichotillomania, pulling their hair out, or really significant skin picking, that when we got them on a dose of naltrexone to stop that, their appetite also went down pretty dramatically. Now, whether or not that will stay, I couldn't tell you, but it was just an interesting side effect that I thought I'd mention. Cannabidol, I'm flying through these and I apologize, but I figure we'll get through all of them, and then you can have a chance to ask questions about any of them or anything I may have forgotten to mention. So I apologize for going so fast. Cannabidiol, CBD oil, is something you may have heard about. It is extracted from the cannabis plant, and it actually reduces anxiety and decreases blood flow to areas of the brain that correlate with anxiety. The data on cannabidiol is limited. There's actually right now none in Prader-Willi syndrome. There is a company doing a study on it in the United States right now, but research seems to show that it would work well for short-term anxiety. The question is really long-term anxiety. Our suspicion is that the body will adapt to cannabidiol with time, and that it won't have potent long-term effects on anxiety. But obviously studies need to be done to show whether or not this will be effective as a longer-term treatment. It is being used for epilepsy, as many of you may know, so is available now from a pharmaceutical company in the United States called GW Pharmaceuticals. But again, the length of efficacy is really unknown at this point. Lactoferrin is one that came up several years ago and still is occasionally mentioned. It is a supplement that contains, lactoferrin is actually itself a component of the immune system in the body and provides antibacterial activities. It is what is in breast milk that gives babies antibacterial activity from breastfeeding and antiviral activities. It also transfers iron into the cells and controls the level of free iron in the blood. For a while, it was being really touted strongly as an immune support supplement. We don't know for sure whether or not this is true. And if it is true, if the brand of lactoferrin or the dose of lactoferrin or whatever is what affects its effects on the immune system, anecdotally, some parents have seen fewer severe illnesses in their children who are supplemented with lactoferrin. But again, I think the jury is still really out on this one, and we don't know long term whether this is going to be an effective supplement for individuals with Prader-Willi or not. MCT oil is one of my favorite supplements in Prader-Willi syndrome. It is medium chain triglycerides. So coconut oil, which you've all heard of and I'm going to talk about on the next slide, is an oil that's composed of short, medium, and long chain fatty acids. MCT is the medium part of that. It's the medium chain triglycerides, so it's partially broken down coconut oil. And the differences between the two are that medium chain triglycerides, this partially broken down coconut oil, is much more easily digestible. It doesn't get digested through the liver like other fats, so it doesn't raise your cholesterol. And so it provides a fast and lasting energy form for the body that's easily absorbed and supports gut health. The MCT itself, the medium chain triglycerides, are made up of 6, 8, and 10 carbon chains. And there's some research going on to look and see some of these lengths of carbons can actually prevent the change from unacylated or inactive ghrelin into acylated or active ghrelin. And so the thought is that MCT actually may decrease the amount of active ghrelin in the body. Ghrelin is the hunger hormone, so it's high in Prader-Willi. And the thought is that maybe by giving MCT, you could possibly reduce the active ghrelin and reduce the appetite. Regardless, what we know is that it is a really nice fat for brain development and brain myelination because it doesn't cause any adverse side effects like high cholesterol or liver fat or anything like that. And it preserves lean muscle mass. Most of the data on MCT is done in middle-aged men who get the middle-aged men paunch. And MCT oil actually has been shown to decrease that fat in the belly while maintaining lean muscle mass when taken as a supplement. Coconut oil has, as I said, a mix of a bunch of different chains, lengths of chains of carbons. The primary one being something called lauric acid, which is 12 carbons long. Coconut oil and lauric acid are great for immune function and for skin health, which is why coconut oil has such a reputation as being a great supplement, especially when rubbed on the skin or hair. But it doesn't contain as much of the medium chain triglycerides as MCT does, because MCT is exclusively those. So MCT has benefits that are unique and separate from coconut oil. Just for those of you who cook, MCT has a really low smoke point, so you don't want to cook with MCT oil because it will smoke very easily, whereas coconut oil is much easier to cook with. Lauric acid actually raises the smoke point, so you can cook a lot of things in coconut oil and get the benefits of having the lauric acid there, by cooking your eggs in it or whatever. And whereas MCT, don't put it on the stove. You'll have a smoky house. Prebiotics and probiotics are something else that I really strongly advocate for in individuals with Prader-Willi syndrome. Probiotics are the bacteria which bestow health benefit on the gut. There are several families of probiotics which are beneficial. The bifidobacteria family specifically are ones that promote gut motility and have been shown to decrease transit time, so that if you've got a child with constipation, the bifidobacteria strains are actually the most beneficial for treating constipation. Prebiotics are the non-viable food components that they're basically food for the probiotics, is how I think of them. They're carbohydrates, they're inulin type fructans that are the food for the probiotics. So the combination of prebiotics and probiotics together allows the probiotics to be more effective because you're feeding them with the prebiotics, and so you get the most benefit from doing both together. Again, these help with bowel movement regularity. They also help with uptake of calcium through the gut, with satiety regulation, and have been shown to help combat obesity in the general population. Right now, there are several groups doing studies on prebiotics and probiotics in individuals with Prader-Willi syndrome. We're currently doing a randomized placebo-controlled trial on some adults with Prader-Willi syndrome using the bifidobacteria strain to see if we can possibly decrease some of the constipation that is so prevalent in adults with Prader-Willi syndrome. Creatine is one that I don't generally use. Creatine is something that is used by athletes. It can help generate extra energy. There is a guy in Toronto, Canada, who works specifically on muscular hypotonia and neuromuscular diseases, and he has recommended creatine supplementation for some individuals with Prader-Willi syndrome. He does recommend that you use medical grade creatine only if you're going to do it at a very low dose. So it's 1 milligram per kilogram. I'm sorry, that's wrong. It's 0.1 milligram per kilogram divided twice daily. And again, this is something you do not want to use without supervision of a physician, because it can cause dehydration. Creatine is a form of a salt, and so you have to take in a lot of water to avoid kidney damage if you're taking creatine. As you know, most individuals with Prader-Willi don't like to take in a lot of water, and so this can be dangerous. We've actually had a couple of kids have long-term kidney dysfunction as a result of being dosed with creatine when they were young children, because their parents wanted to try to help them have better muscle mass. And so creatine is one that does need to be very, very carefully monitored for children if you're going to use it. Melatonin, I think, is the last one I'm going to talk about. And melatonin is, as you probably know, it helps regulate sleep. The levels of melatonin naturally fluctuate with the seasons. They peak twice a year, January and July. And the primary role of melatonin is to promote induction of sleep. Now, I say this because melatonin does not help maintain sleep. It helps put you to sleep. Most kids with Prader-Willi don't have a problem falling asleep. It's the maintenance of sleep that's the problem. And this melatonin, therefore, does not typically help with sleep problems commonly seen in Prader-Willi syndrome. However, if your child does have a problem falling asleep, melatonin is an excellent supplement. It is one of those where you need to know that more is not better, that higher doses of melatonin actually affect other hormones that can have negative effects, whereas lower doses can stimulate oxytocin production, which helps regulate sleep, as I mentioned in the first talk. So lower doses of melatonin are better than higher doses of melatonin when it comes to sleep. The recommendations for melatonin for children are to take the smallest dose, which is 1 milligram tablets, and divide it into quarters and give 1 quarter per night at bedtime. So, the supplement question, I ran through all this very quickly, and I'm sure you guys have a lot of questions, but I do want to reemphasize that I want you to be careful. There are risks with any supplements, and so you really do want to talk to somebody about supplements before you use them. Again, many physicians are not going to be super familiar with supplements. Most of us are not trained in supplement use. However, you as parents are probably way more knowledgeable than most physicians are. And although, I can't give medical advice by email or anything to patients that I haven't seen, I can at least send you handouts or articles about the supplements if you would like to take to your physicians, to discuss them with your physicians, because I don't want you starting anything that physicians have not specifically approved. Specifically the very young are the ones that are on the most supplements, I think, and they're the ones that it's actually the most dangerous for, because their kidneys are not developed yet. They don't filter things quite normally, the liver the same way, and all these supplements go through either the liver or the kidney. And so you do want to be very, very cautious, especially with babies, with using supplements, and that you want to speak to a physician before starting them. And I think that's it.
Thank you very much.
Now, question.